Hi, I am Dr.YVRao, plastic surgeon. I am working as a consultant in Sunshine Hospitals. Today we'll talk about liposuction. Many of you might have heard about liposuction. Some good things and some bad things. In brief, liposuction means lipo means fat, suction means removal of the fat. So we try to inject some fluid and then take out the fat. That is in a nutshell about liposuction. Many patients come and ask about, for example, a top to bottom obese person comes and asks for liposuction. In such persons, we try to refuse the liposuction because in plastic surgery, with liposuction, we can shape the body better. We are not here to reduce the weight. We are here to shape the body. In the process of shaping of the body, when we take out some amount of fat, there will be some amount of reduction of the weight also. But if you take, for example, 1 liter of fat, 1 liter of fat doesn't weigh 1 kg. So even if I remove 5 liters of fat, well, the person doesn't reduce by 5 kgs. So it occupies more volume than weight. That one should understand. So when is it indicated? There are certain people where, or certain areas where there will not be any reduction in the girth. For example, tummy region, hips and arms region. In these 3 regions, what happens is that's called stubborn fat. So where in spite of the fasting methods, the fat will not reduce. If we try to reduce by liposuction such areas, then the patient gets very good result. So what is the method? It can be done under local anesthesia, it can be done under general anesthesia. General is where we make the patient unconscious and then bring out the consciousness at the end of the procedure. Local means where we try to give injections at the patient's at the site and then try to suck out the fat. In the local, where local is done is when small areas, for example chin, in the arms, we can attempt it under local anesthesia. Whereas large areas, for example tummy or buttocks, such areas we may have to go for general anesthesia. So procedure. In the procedure part, we try to first infuse certain amount of fluid. Why certain amount of fluid is injected is the blood vessels, they constrict. So what we try to inject? A mix of normal saline and some adrenaline solution. The adrenaline tries to constrict the blood vessels and the normal saline tries to ease the fluids or penetrate into the various tissues and make the areas supple so that we can suck out easily. So many people have the doubt that how much fat can be removed. Usually not more than 10%, that is the upper limit. Sometimes we can go for even 10%, 15% also. But the safe is 7% to 10% of the body weight. For example, a patient weighing about 50 kgs, we can remove up to 5 liters of fat. Not kgs, 5 liters of fat. How we take out the fat? We just make some stab incisions of 1 centimeter or less and then try to suck out the fat with a small metal cannulas. In this context, I like to tell you about there are 2-3 options available. The principle is the same, but the mechanisms have come that is different. For example, in the same cannula, if the tip has some laser tip, that is called laser liposuction, which has become almost obsolete these days. And the other one, if the tip has some vibratory mechanisms, that is the mechanical one, connective tissue and bring out the fat easily. The third one has some amount of ultrasound also transmitted to the vacuoles so that it breaks the fat vacuole and then produces excellent suction also. And the beauty of this ultrasound, that is laser liposuction, is it can produce some amount of skin retraction, but the complications are equally bad. That means it can produce extensive areas of the skin necrosis. That's why most of the people all over the world still follow conventional liposuction. That is a simple metal cannula with holes on the sides and tip. So this is what the procedure. So liposuction, a properly selected patient with a properly selected method by a properly trained plastic surgeon gives excellent results.
Sunshine, it's our sunshine.